Hello, welcome everyone. This video is a basic introduction for behavioral exceptionalities with respect to regular school basis. Behavior exceptionality, a learning disorder characterized by specific behavioral problems over such a period of time and to such a marked degree and of such a nature as to adversely affect educational performance, and that may be accompanied by one or more of the following. A. Students are unable to build or maintain interpersonal relationships. B. Students are having excessive fears or anxieties. C. Students tend to have compulsive reaction. D. Students are unable to learn, and that cannot be traced to intellectual, sensory, or other health factors, or any combination thereof. There are some typical types of emotional characteristics of emotional or behavioral disorders. They are anxiety disorder, mood disorder, conduct disorder, schizophrenia, attention deficit hyperactivity disorder, which are also known as ADHD. Anxiety disorder. Anxiety disorders are a group of mental disorder characterized by significant feelings of anxiety and fear. There are many types of common seen anxiety disorders among students, such as separation anxiety, generalized anxiety disorder, phobia, panic disorder, obsessive compulsive disorder, and post traumatic stress disorder. Mood disorder. A mood disorder is a mental health class that health professionals use to broadly describe all types of depression and bipolar disorders. The most common types of mood disorders are depression, suicide, and bipolar disorder. Conduct disorder. Conduct disorder is a major health and social problem which is the most common psychiatric disorder in childhood. The diagnosis is given to children who display persistent, severe antisocial behavior, such as tantrums, verbal and physical aggression, lying, stealing, and violation of other people's rights. Although the greatest damage to society is done by delinquent adolescents, the disorder usually starts below the age of 7 years, with the oppositional defiant subtype. The ineffective parenting and poor disciplinary practices at home and at school are major determinants of this disorder, which has widespread effects on many levels of society. Schizophrenia. Schizophrenia is a complex brain disorder. It often runs in families and can cause troubling symptoms. These include hearing voices that are not real, having trouble thinking clearly, and relating to others. ADHD, attention deficit hyperactivity disorder, is a common childhood disorder that affects behavior at home, at school, and with peers. Some symptoms may include off task with assignments, doesn't seem to listen, on the go all the time, often fidgety or physically restless, and difficulty waiting for his or her return. Behavioral characteristics of emotional or behavioral disorder are characterized into two types: externalizing behaviors and internalizing behaviors. Externalizing behaviors are observable, shown as aggression, acting out, non-compliant behaviors. Internalizing behaviors are not always observable. It's sometimes only acting against students themselves. It might be shown as withdrawn, depression, anxiety, obsession, and compulsion. Suspected etiologies of emotional or behavioral disorders can be characterized into two types: biological risk factors and psychosocial risk factors, which are also known as environmental risk factors. Bipolar disorder, schizophrenia, obsessive compulsive disorder, Tourette syndrome, and depression are suspected to be genetically influenced. Some biological factors for emotional or behavioral disorders are often include infection, lead poisoning, and toxin exposure. Parental discord, poverty, maltreatment, maternal rejection, poor healthcare, and poor nutrition are the potential psychosocial risk factors for emotional or behavioral disorders. The characteristic of students with emotional or behavioral disorders can be categorized into three types. The first one is learning characteristics. It is commonly shown related to the range of intellectual abilities, chronic school failure, absenteeism, grade retention, and school dropout. The second one is social characteristics, which can be found as difficulty building and maintaining relationships, aggressive behavior, experience rejection, externalizing and internalizing behaviors. The last type of characteristics that students with emotional or behavioral disorders might have are related to language or communicational characteristics. Students tend to have deficits in the area of pragmatics, receptive and expressive language difficulties, and limited or inappropriate language use. Thanks for watching. See you in the next video.